And welcome to Aging Matters. This is a show that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet. I'm the Public Advocacy and Outreach Manager for the agency. I'm excited for our show today. We have a lot of guests and we're going to be talking about falls prevention awareness. And my guests I'll introduce from my immediate left is Jennifer Barney. She is the Injury Prevention Outreach Coordinator for Tower Health Reading Hospital. Thank you, Jen, for being here.
Thank you, Ann.
And next to Jennifer, I have two folks, Gabriella Caracciolo, close, and Sean Schirripa. Okay? They are physical therapy students at Alvernia University. So welcome. Gabriella and Sean, thank you for taking the time today to share information with us regarding falls prevention. I wanted to start first, I found some statistics that I wanted to share and really drill down some of the importance of how falls can affect you and the frequency of falls. Falls are common no matter what age. However, for many older adults, an unexpected fall can result in serious and costly injuries. Some statistics that I have from the Center for Disease Control, CDC, is over 1 in 4 Americans aged 65 and older fall each year. Falls are the leading cause of fatal and non-fatal injuries among older adults. The majority, about 60% of falls happen in the home, 30% in a public setting, and 10% in a healthcare center. For older adults in the United States, and here's where I want you to pay attention on this one, fall death rates went up by 30% from 2007 to 2016, and researchers predict that there will be 7 deadly falls every hour by 2030. So we obviously need this show and to really talk about ways that we can prevent falling. Falls certainly are a growing number of older adults also have a fear of falling, and as a result they then limit their activities and their social engagements. Then that limitation can also result in physical decline, obviously some depression, social isolation, and so all of that kind of also then contributes to the potential of falls and fall injuries. I like this one because this really says it all in this next sentence. Falls with or without an injury carry a heavy quality of life impact. And I think that says it all. So why we're here is let's talk about how we can prevent falls. That's what we want to share with you today is fall prevention and an event that we're going to have later this month. In September 18th to the 24th is Falls Prevention Awareness Week. And we have a local Berks County Falls Coalition that is having a falls awareness event during that week. So we're going to talk about that at the end, but let's talk about fall prevention. And I'm so happy to have Gabriella and Sean here as physical therapy students at Alvernia really can tell us as older adults what things we can possibly do, a few exercises or movements that might be helpful. And I think of people like myself, if we're sitting at home at night watching TV, sometimes some things I think I can do from some of our health and wellness classes, I do while I heat up something in the microwave. So I'll turn it over to both of you. You can tell me from here some of the things that you'd like to share with us as to ways individuals can help prevent falls through movement or exercise, building up our muscle strength balance.
Sure. Do you want us to display the exercises?
Please, if you will.
Absolutely.
And tell us, if you will, obviously what you're doing and what that movement is helping us to do to then prevent falling.
Yeah, so thank you, Ann, for having us. And like you said, we want to focus on fall prevention in the home. So take this as your countertop at home in your kitchen, or even you can use a chair, a kitchen chair if that works easier for you to hold on to. And you can do a ton of exercises just standing here at your counter. I would make sure you have a sturdy surface if you aren't using your counter. Especially have a chair nearby in case you need to sit down, because sometimes the breaks are not you need a break and you don't suspect one. So
Yeah. If it's not a countertop, sofas work awesome. You know,
Okay.
something that's in a really common area, something that's sturdy and nice and heavy to stay flat. Sometimes rolling objects, anything like
I was
that.
going to say, if you take like my old kitchen chair and it's on rollers,
Yeah,
that won't work.
Absolutely, absolutely. Or stools, though
Yeah.
they might provide some support, it's really important to keep yourself safe at home. Though you're doing the exercises, you know, they can come with a risk in itself. So being safe there, as Gab mentioned. The first couple of exercises that we're going to talk about have to do with balance. Balance is obviously something I think everybody can work on in the elderly population. It's a huge risk is we lose our balance, and sometimes it refers to our strength. Sometimes it refers to our vestibular system, our ears. You know, not every person just has strength deficits. It might be vertigo or something like that. You know, they have recurring cases of that. So there's more than just, you know, you're weak or you lose your balance a lot. But in general, some great balance activities are going to be take maybe like a kitchen timer. Those work wonderful. Or we're in the smart age now, smartphone, watches, anything that's got a timer on it. And really easy standards is just do 3 sets of 10 seconds of these few exercises that we're going to show you. So the first one, Gab's going to demonstrate, but I would ask the patient to put your feet together. You could start with your hands on the countertop and then slowly remove your hands. So you would stand here with your feet together facing the wall for 10 seconds. I have a habit of guarding my patients. Okay, so then you would take a rest break in between. You would do that 3 times. There's progressions to that. Some people might have difficulties with standing there without holding on to something and their feet together. So the progressions are going to be hands on the desk or countertop, and then you can move into fingertips, 1 finger, and then moving off. So those are just stability, not issues, but you know, it's grading the exercise.
So let me ask you on that, if it's 3 sets, like for 10 seconds, could I also maybe do that a couple of times in a day then? So let's say I got up in the morning and I had my breakfast and coffee, and while I'm waiting, I'll do my 10 second. And then maybe mid-afternoon or evening as a continued way of doing that instead of once a day. I could increase it that way, right?
Absolutely, absolutely. I don't know if you want to speak on that at all.
yeah, so 2 to 3 times a day is pretty good. If you want to do it, we usually try to tie it to your everyday activities, kind of just like what you said.
Okay.
We'll suggest when after you eat breakfast to do them, or before you eat breakfast, or when The Price is Right is on, or let's make a deal. The specific activities will kind of key
Trigger
their
it.
mind to, all right, let's do my exercises. So if you name things throughout their day, they have a better chance of remembering. So that could definitely be a useful tool.
Great, thank you.
Convenience factor, you know. It's hard to get people to the gym. It's hard to get, you know, people to want to exercise, but if it's easy and it's convenient, you know, you take a walk to the kitchen, you pop something in the microwave, you got a timer right there.
Exactly.
30 seconds of our next exercise, let's
Okay.
say tandem, you know. 1 foot in front of the other, same progression with the hands. Try and not hold on, but this is more difficult. Your limits of stability are now smaller, right? It's directly under you. And then you would switch sides. So it would really be 6 sets, 3 sets of each side. So left in front of right for 10 seconds.
Okay.
Oh, I said that backwards, but right in front of
One in
left
front of
to
the
stay
other.
consistent. Yeah, 1 in front of the other.
Yeah.
3
That-
sets of
That's
10.
a set, and then 3 of those. for 10.
Exactly.
Okay.
Exactly.
All righty.
So then the last one would be single leg stance. So picking 1 leg, 3 sets of 10, switch legs, 3 sets
And I
of
see
10.
now she's holding on.
Correct.
So again, one of those where you can start with maintaining your hand balance on a table or chair countertop. Again, the advancement would be the similar thing, maybe the fingertips, and then maybe like 1 hand or 2. Okay.
And you don't have to get your leg all the way up, just even a little bit off the ground is really what
okay.
we ask for, or it will make an improvement no matter what. So as long as you're doing something, you don't have to feel like you're doing it wrong or you're not doing it well enough.
Correct. And you might find yourself, oh, this is easy with my feet together. You know, okay, well, try tandem more times.
Right.
You don't have to go to feet together, that progression every time. If you want to try single leg, and that's what you're up to, and maybe you have to do single leg, but with support, you can kind of grade it from there. Maybe go back to tandem and try with completely no hands, and then work into just fingertips like you mentioned before, but with the single leg stance. I think we're going to move into some actual exercises
Okay,
now.
great.
Balance is something we like to focus on, but strengthening is very important as well as power. So, do you want to switch and go through a couple exercises?
Yeah. So one last thing about balance is we always tell patients to, so the contributors to balance are your somatosensory system, what we call it, your vestibular, and your vision. So in order to prevent falls, we really do recommend getting your eyes checked, your hearing checked regularly, and also your teeth, believe it or not. Going to the dentist is a big, we just learned is a big contributor to falls as well. So making sure that you keep up on your doctor's appointments, and especially your hearing and vision appointments, is really
It's amazing how they
that.
all relate, isn't
Yes.
it? And making sure that that's all
Yeah.
taken care of.
Yeah, that's
for
always
even
something we
as
check with
simple
our
as balance.
patients. So
Great.
I think it's important to note somatosensory is your sensation, proprioception, your touch, and then vestibular, we refer to our ears. It helps let us know where our center of gravity is.
Yep. All right, so some strengthening exercises that we can work on. First, holding onto the counter or the table is just a mini squat. You could do it with one hand, no hands, and you just want to go down very little.
I
You
was
don't
going
have
to say,
to
or
go
you need
all
your
the
own
way
spotter
down.
in case you go
You
too
just
far.
can go down a little bit. We tell our
Okay.
patients all the time, it doesn't have to be a deep squat. Even a little
Okay.
squat gets the job done.
Absolutely.
And yeah, 3 sets of 10 of those. So if you do 10, 3 times, that's usually adequate, like 2 to 3 times a day. A next one we could do is bringing your heels off the ground. This doesn't just help with strength of the muscles that you use to walk, but it also helps with your standing, and it also helps with your circulation. So,
And I
helps
think
with
of
your
that
blood
also,
flow.
a lot of people who are have to do steps
Yeah.
on and off a bus.
Yep.
You know, those kinds of things. That's
Exactly.
how I always think of wanting to make sure I can keep doing that.
Yep. And that, just going off of that, actually, the next one is bringing your knees up, doing like a step. This is very functional. Like you said, getting in off the bus, even going upstairs, downstairs, it really works those muscles. And it's easy to do while you're just watching TV.
So let me ask you, how many of each of those would you recommend doing then for us?
I would do 3 sets of 10 for all of them, this being 1.
So
And
on
then
each
2.
leg is 1.
Yeah.
Okay.
We usually tell patients they can do it how they want. They can do all 10, or switch off. It's up to them, whatever is going to make them keep track of the numbers.
Yeah.
But
We keep coming back to like convenience factor and getting people to follow through with their exercises. One way to do that is keep it as simple as possible. Switching up the sets and reps for each of the exercises, 8 sets of 12, or whatever that combo might be. It gets very confusing, and it's just giving someone another reason to not want
The heck
to
with
do
it.
it.
Yeah.
Yes.
Right. So when we send people home, especially the first few times that we're with a patient, usually 3 sets of 10, whatever you're doing, if it's just a 10-second count or if it's 10 reps, whatever it might be, it's very easy to get 30 reps or 30 seconds, and it's effective. If you're doing any less than that, it's not effective.
Okay.
If you're doing any more, you might fatigue the patient or the client, and now you're potentially not going to finish the exercises, or you could get so fatigued that maybe they hurt themselves or maybe they fall. It's important to have that leeway. And I was actually going to show a couple progressions or regressions for those couple exercises.
Sure.
So we'll take this chair, for instance, and I'm going to place it here. I think you're standing in front of it. But why don't you take a seat, Gab? Okay, so first one we're going to do is a heel raise just in a seated position. So go ahead and raise your heels off the ground. Count to 3. 1, 2, 3, and then lower. Raise your heels off the ground, and then lower. Okay? So this is sort of a regression from the standing at the countertop. Not everybody's going to be able to lift their whole body weight up off of the floor like that. So this is a great place to start, as we mentioned, watching television. You can do this for an hour. You know, it's great. It's good exercise. It gets the blood flowing back up towards the heart. From there, I was thinking we'll just do a sit to stand. So go ahead and rise up from the chair. Instead of doing a mini squat where we have to fight gravity and there's nothing behind us, what I would have someone do is make sure whatever you're sitting onto is either a sofa or some kind of chair pressed up against the wall.
Okay.
And you can just sit down into the chair safely, stand up from the chair. 3 sets of 10 might be a lot for this type of exercise, so maybe do 3 sets of 5.
And again, that could be throughout the day.
Correct.
So I could do my one set in the morning, a
Correct.
second set later. Okay.
Generally, I recommend people, when they're first starting to exercise and get their bodies moving, try it once a day. If you feel good for the first couple of days that you do the exercises, move on to twice a day. Do once in the morning when you wake up and you get yourself moving. Do once at night when you're all finished. Any other exercises that you want to show?
Yeah, I was just going to show one more. Holding
need
on.
this?
No. Holding on to the counter. Another good one is to kick your leg out to the side. This is one that a lot of people don't think, but it really helps you with going up and down the stairs. It works your butt muscles, so which we rely on a lot for standing, stepping, balancing, all that. So making sure you're doing these is a good one as well. You can do it even a straight leg back. There's all different combinations, so those are all good to get your legs moving as well.
I think something to address here is pain.
Okay.
And pain can be a limiter as well. It can be a reason people fall. It could be the start to odd habits when walking and avoidance, and that could lead to a fall.
Yep.
And I think we'll get into this a little bit more, but these are things that we might go over at our Preventions Day, as Ann's going to get into later. But keep in mind that pain is not good. You know, we should not stay away from it all the time, but we should be very real with ourselves and our tolerance levels. If any of these exercises are hurting while you're doing them, I would urge you to stop and get a hold of a professional, get some advice from somebody else, and maybe find some regression or an adjustment to the exercise. It might not be the exercise even, it could just be the way that you're doing it.
Exactly.
And sometimes a second set of eyes, whether it's a physical therapist, whether it's an occupational therapist or physiologist, let's say like an exercise physiologist, anybody, ask for help.
Well, and I think too, if you have pain, then perhaps there's a cause of that isn't, as you said, the exercise. So you want to make sure with your regular checkups that you're addressing that with a professional, with your physician, and then maybe they'll refer you again to a therapy group so that you can learn how to do them properly, and that you can take that back then to your home if that hadn't occurred and you decided to try these. So.
Yeah, and also your breathing is very important. If you're getting short of breath, or if you feel dizzy when you stand up, take a second and see if it passes. But if you have orthostatic hypotension is what we call it. It's when you change positions and your blood pressure drops and you get dizzy. So give yourself a second. But if you're finding yourself short of breath or your color is turning white or anything, please sit down and call somebody.
And one of
It's
the
really
things
important.
I observed as you were doing it was not the speed in which you were doing it, right? So it's not a race. We're not needing to do up on our toes or whatever, like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and okay, now I'm done. It's really a nice, gradual kind of way to do it.
And that's something that's really important that we work on at home is the slowness. While we're in the clinic, sometimes we work on power, which is when we add the speed aspect. But we want to emphasize that that's usually not what you want to do when you're not supervised by a professional.
Okay, good. Thank you. Thank you.
No problem.
There's certainly a lot of other opportunities to learn about what we can do. One of the things I wanted to mention is that our agency has health and wellness classes there are various workshops that we have, and we have several of those that are focused on balance, strength, and a lot of those exercises are shown in those classes. So I would encourage people also that they might want to take something more formal, and it always helps for me, at least, if I have somebody else to go and do it with, or at least meet there. So sometimes that formality is great because I don't feel alone, and I'm doing it hopefully the right way because somebody's helping me to make sure I'm doing it the right way. So we do have health and wellness classes. If anybody is interested in having more information that has these types of exercises in it. So we're going to switch gears slightly and say, so learn more about some of the exercises that you can do, some of the screenings that Sean and Gabriella will be doing at the Falls Awareness event. They'll be there so you can seek them out and talk with them further, maybe demonstrate those again, have some other pieces of information from them. But right now I'm going to talk with Jennifer Barney, who is the Berks County Falls Coalition coordinator, I guess I'll call it. And so let's talk about our second annual Falls Prevention Awareness Day here in Berks County.
Sure, yeah, so we're really excited about this event. It's going to be September 22nd. That's on a Thursday from 9 a.m. until 1 p.m. at the Alvernia University Tom and Helen Flynn Complex. We have a bunch of different educational opportunities. We're going to be providing screenings on grip, balance, and then we're also going to be providing free flu shots. We're going to try to make it as engaging as possible by doing some fall prevention bingo, and there's going to be plenty of raffle prizes and bingo prizes. We're also going to offer a free lunch to those that attend. But we really just hope you learn a lot of fall prevention information and feel like you're able to gain all the information to keep yourself safe. We will have vision and hearing screening. I know that was one thing we discussed earlier.
Yeah, I was just going to say, I mean, you know, that they were mentioning about having regular checkups and also with the hearing and the vision and the other sensory things. So I think that's great to be able to have those screenings at the event.
Absolutely, and you will have access to the indoor track. So that's another opportunity. We're going to link you up with our students that day where we're going to kind of have them be student navigators, where they're going to, if you want, have someone to walk with you and kind of take you around to the resource tables and gather that information. We have, I think, about between 50 and 100 students joining us that day, so there'll be plenty of support. We are going to have support in both English and Spanish, so everyone is welcome.
And I might add the other key word that we all love, it's a free event. There's no fee for all of these different organizations to provide all these different screenings, which is wonderful. I don't know that you can get one big opportunity like that in one location that has expertise in those fields to really help us answer our questions. You know, as part of the coalition, you know, we're going to have those screenings, and you have an opportunity to really put all those pieces together. How is my nutrition? How is my bone density, perhaps, the hearing, the vision, all of those pieces. I always say to help keep me upright so I don't fall over. And they're going to be throughout the bottom area of the Flynnplex, right? So we have resource tables, screenings, the walking in the track. There's also a class demonstration, right?
Yeah, so Berks Encore is going to be providing a mini session where it shows some examples of fitness in one of the classes that they offer, Healthy Steps in Motion, and so that's a class that is really enjoyed by most of the participants. And we are going to have, Tower Health is going to have their pharmacy department there, so that's another great resource because a lot of medical questions come up in regards to medications, and they're going to have their stroke program, and the rehab is going to be joining us there as well from Tower Health. So there is a lot of different organizations that will be participating. I think even AAA is going to be joining us. They have a program in regards to Car Fit, a program where you want to make sure that you're driving safely as well. So I feel like we're covering all of our bases. What do you think?
Yeah, I do, and we'll go
Yeah.
back to something earlier we discussed about our own environment too,
Yeah.
right? Go ahead,
No, I
John.
was just going to
Okay.
add, I'll come back to that, but as you could tell, this is really an interprofessional event. This is not just come out and see the physical therapist or, come out and get some exercise. This is a really, really exciting event for people, and there's so much to provide to anybody who wants to come out. For a free event, there's so much to offer. It's more than just, we'll show you some exercises or we'll do screening of, whether you're a fall risk or not. We will do those things, but I think it's a great opportunity to see if there's something that you're missing. Keep yourself as safe as possible out there.
I think it's rich with all of that. I think it's one place that you can go to get a question answered if
Absolutely.
that's all. If that's what
Absolutely.
you want. I want to know more about this. Show me that again. Something we're encouraging people to really. I go back to the statistics. Be aware, falls happen to anybody at any time, but the older adult, more serious things may happen, which has real consequences potentially. So in one more minute that we have, did you want to say something about the event, Jen?
So I actually just wanted to note, I'm not sure, I know we talked about some national statistics, but just so you know, at Reading Hospital Trauma Department, we get about 2,000 falls a year. So it is important, and that's why we feel strongly about this event as well. And so we hope that everybody can come out and join us.
And we know that with little time, but that there are other environmental factors in our homes that we didn't get to cover today that we know we can do to make it safer and better for us, whether it's putting things in or taking things out,
Correct.
lighting things up.
Correct.
There's a variety of things that also will be shared. And I just think it's going to be a super event. Available. It is certainly conducive to people who need to utilize devices such as a walker. It is an even level in the door with an elevator to the lower level where the event will be happening. As Jen mentioned, there's going to be some good students accommodating that, directing, navigating, and sharing about how to know what's where. And the last thing that I do want to mention as we wrap up is that although it is free, we do ask that you register for the event. We want to have a good idea ahead of time as to how many we can be expecting. So I'll let Jennifer tell us how to register.
Yeah, so you can go ahead and give Tower Health a call. The number is 484-628-HELP or 484-628-4357 and ask for the Fall Prevention Day event.
Thank you. And if you didn't get that, please feel free to call me at the Berks County Area Agency on Aging. My name is Ann Barlet, and I thank you tuning in for Aging Matters.